Hello guys, welcome back. This is Kweku. I'm a pharmacist. Today we're going to briefly look at LisinoPRIL. We're going to take a look at its side effects, some precautions, and some best practices. Just a little disclaimer before we start. This video is for informational purposes only and is not intended to be a substitute for medical advice from your physician. Please continue to follow any specific instructions provided to you by your local healthcare provider or providers. So first and foremost, what is LisinoPRIL? LisinoPRIL was first approved for use in 1987. It belongs to a class of medications called angiotensin-converting enzyme inhibitors, or ACE inhibitors for short. Its uses are divided into two, that is the FDA-approved uses and the non-FDA off-label uses. The main use for which most of us are familiar with is in the treatment of hypertension. That is very common. That is the number one reason why LisinoPRIL is prescribed. It is also used in instances of acute myocardial infarction. That is when you have a heart attack. So usually if there's a heart attack within 24 hours, if LisinoPRIL is given or any time after that, studies show that it reduces the mortality rate or it improves the chances of survival. So LisinoPRIL is given in such instances. It is also used as an adjunct in heart failure. That means that in heart failure, it is used, but not by itself alone, but in combination with other medications to treat heart failure. The non-FDA uses include diabetic nephropathy. And what I mean by non-FDA uses is that the FDA hasn't necessarily approved its use in that area. However, practice and experience by a lot of doctors show that it is beneficial in those circumstances, and therefore it is safely used for that. The first instance is diabetic nephropathy. LisinoPRIL is known to have kidney protective functions, so every so often you see it given to diabetic patients just to slow down the progression of nephropathy in such patients. And believe it or not, it's actually used in migraine prophylaxis, to prevent migraines. It is not very widely used in that respect, but it is definitely something that is considered under some circumstances. The next is the side effects. Number one and the most common side effect is a cough. This tends to be a very dry cough, and it actually in the pharmacy, what I usually see, if anybody is going to go off LisinoPRIL, I want to say 8 or 9 times out of 10, it is due to the development of a cough. It is a persistent, irritating cough, and if it happens, the unfortunate thing is that an alternative medication will have to be prescribed by the doctor. There are some people that will complain of chest pain, dizziness, headache, hypotension, hyperkalemia, which is high potassium levels in the system. There is another very rare case, but it could be life-threatening if it happens, is Stevens-Johnson syndrome, which usually manifests itself in a rash. So if any time after taking LisinoPRIL you observe a rash, it will be a good reason to seek medical help. It may or may not be serious, but if it is Stevens-Johnson syndrome, then it definitely requires medical attention. All in all, LisinoPRIL is very well tolerated. It is safe. It has been used, like I said, it was approved by the FDA in 1987. So it's been around for quite a while, and it's been used very successfully, especially in the treatment of hypertension. Next, we're going to take a look at some precautions to take while you take LisinoPRIL. The first one is in the area of pregnancy. LisinoPRIL should be discontinued as soon as pregnancy is detected due to the risk of harm to the fetus. This is especially true during the second and third trimesters. So generally speaking, LisinoPRIL is not good for pregnant women. The second precaution is for people with high potassium levels. LisinoPRIL should be used with caution if you already have high potassium levels, or if certain risk factors exist for developing high potassium levels. Such risk factors may include kidney disease or concurrent or simultaneous use of LisinoPRIL with other medications that tend to raise potassium levels. For this reason, it is always a good idea to let your doctor know if you are taking any potassium supplements, or even in some cases, potassium-containing salt substitutes. Your doctor will typically monitor your renal function or your kidney function, and also your potassium levels whilst on LisinoPRIL. High potassium levels, or hyperkalemia as it is called, may result in muscle fatigue or cramping. It may result in weakness. For some people, it may be nausea and vomiting. And most importantly, for some people, it may result in abnormal heart rhythms. So it's definitely worth taking seriously. The next area of caution is for people with a history of angioedema. Angioedema is a condition that is characterized by a rapid swelling of areas beneath the skin. It is normally an allergic reaction, but can also be hereditary. Generally, if there is any history of angioedema, be it medication-induced or hereditary, that may mean that you may not be a good candidate for lisinopril, and you will have to inform your doctor for alternatives, as angioedema can be serious and even sometimes life-threatening. As I said earlier, all in all, lisinopril is generally a safe medication and has been used successfully over the last couple of years, so feel comfortable taking it. However, if you experience any of these side effects that have been discussed, it's definitely a good idea to discuss with your doctor. Thank you for staying through the video. If you found this information useful, do well to subscribe and hit the like button. Also, if you have specific questions, feel free to put them in the comments section and I'll take a look at them and address them. Thank you so much.